Hi. I went to the side event about adult drug use and regulation, the future of drug policies, and it was super good. I mean, because they talk about of in another perspective about human rights, health, public health, and pleasure. Why people take drugs? Pleasure. Or I think it was a super nice talk, very interesting, and also because Dr. Carl had empowered the youth, sorry, to go out of psychoactive substance closet, and I think it's what we have to do as youth in drug use. So we need to reform the drug policies for better conditions for prevention, treatment, and for decision making if we want to use or not use. So hi again. Coming back from Way Forward developing gender sensitive treatment programs to eradicate barriers for women. It discussed that the most treatment programs worldwide do not have incorporated yet the gender perspective. So it doesn't take account the specificities or very specific necessities of women who use drug or who want to quit to use. And I think it was a super good side event because they make a call. We made a call of the necessities that women need for break down these barriers. And also, I was wondering, what about young women? Do we have the same necessities as an older women? Well, I think that it's a point of view where we should make a zoom on it and see if young women, older women have the same necessities or not, or well, how can we do a good treatment or prevention work for them, with them. Hi everyone. I just came from the side event called Promoting Evidence-Based Drug Policies and Interventions, I don't know how to spell this word, in human rights in Europe. So basically, they say we should generate more evidence about treatment, prevention, what it works, what it doesn't work. So that is good. I think there's so much motivation to do this. But if we want to do something, for example, in prevention area, we should get involved to youth because we need them, we need us for get a more specific point of view what is going on with youth in drug policies and drug treatment and prevention and so on. So
Hi, today I attended a side event, New Trends in the Drug Market in Africa. The event was organized by Institute for Security Studies. This side event focused on synthetic drug trafficking in Africa, its use, and the criminal market. From the speaker's presentation on research findings carried out by PWDs across different African countries, there was a notable rise in trafficking of synthetic drugs to the African market, as well as the use of the drug. This was attributed to its uniqueness in availability of the product, availability of the ingredients, and the diversity of the market. It was from a case study of Mauritius' synthetic drug problem that the speaker encouraged countries to contribute to the World Drug Report, a report that is normally released every 26th of June. This report is normally contributed via filling in an annual report questionnaire, as this questionnaire is aimed at informing effective drug policies and programs. Thank you. The role of family and schools in working with youth and students in addiction prevention was the other side event I attended today. The event was organized by Yayasan Green Crescent Indonesia and supported by Connectadas Pelavida, Thailand Green Crescent, and UNODC Prevention, Treatment and Rehabilitation Section. In this event, speakers from Green Crescent Indonesia and Thailand gave briefs of the problematic drug use among young people and students. The prevalence of problematic drug use was on a steady increase. Thus, the integration of prevention of drug abuse in schools and families involving NGOs, local communities, and government leaders to these programs. Giovanna Campello from UNODC also talked about family and parenting skills program that help parents by developing a parent-to-child bond, citing that evidence proves it can prevent substance use among young people. Evidence on the effectiveness of family skills, training in violent, poor, and displaced communities were also shared in two different reports on violence prevention and for mental health. All this available on the UNODC website. Thank you. The other side event I attended today was Frontliners for Curbing Substance Use Among Children and Youth During COVID-19. This event was organized by Slum Child Foundation and supported by National Anti-Drug Union and the UNODC Civic Society Unit. The event highlighted on the work of CSOs in curbing substance use among children and youth in the context of COVID-19. Slum Child Foundation identified problematic drug use among the youth, teenage pregnancy, and an increase in street children as one of the major impacts of COVID-19 amongst this population. Slum Child Foundation developed interventions such as offering psychosocial support, food, and cash transfers to mitigate these measures. I was keen to hear the mention of harm reduction as an intervention, but sadly, I didn't hear any about that. Still on this event, one of the speakers urged CSOs to focus on education and policy reforms that enhance life skills among the youth. NGO Marketplace was an interesting online global platform for UNODC NGOs working on drugs. The platform has a number of registered NGOs around the world. On this platform, NGOs share different activities, different events, and different contributions while working on drugs. I believe this is a timely platform considering the times that we are in, and the times that we are in, I'm talking about the COVID-19 pandemic. Thank you.